speaker is George Abawi, that Cornell has been doing with soil health and how that relates to our work.
Good morning, still morning. I'm sorry to join you a little bit late. I'm glad to be here. I'm really delighted to hear so many of you using cover crop, because a good soil should always be covered. It should never be bare. And that's the way to really manage soil. And not only for erosion, but for all other things, to maintain the aggregate stability, to increase organic matter, and so on. We could talk about that later. I just want to let you in advance, our soil health team at Cornell was established, work program team was established way back in 2003. And it's a multidisciplinary team. We have a lot of growers have been part of the team. And we've done a lot of work, and I really don't have time to tell you what we do, but I just want to tell you in advance, we don't have anything done with garlic as far as trying to relate these practices and on garlic. And actually, we've done very little on onion, with onion grown on organic soil, and again, different type of soil. But anyway, I'm just going to talk about the kind of general principle, what is soil health, why we're concerned about soil health, and how we measure. We develop protocol at Cornell, which you actually could submit a sample and you get a result about your status for your soil health. And then some of the connection between the kind of soil health and kind of root health or plant health. But I could excite it sometimes, talk too long, but I know the lunch will be here soon. I'm sure that won't be a good idea. But so I like to go just kind of over some, and hopefully we could, the main thing would have a good discussion on how this relates to garlic production. So what I like to do really briefly, talk to you about, just briefly, what do you mean by soil health? Everybody talking about soil health, soil quality. And then, telling you a little bit about what the protocol is about, how to develop and how you could submit a sample, and what does it mean. And then, like I said, just briefly how to connect these practices to plant health and root health. I'm kind of, some of you know, I'm by training, I'm a plant pathologist, plant nematologist, but I've been dabbling with soil, but I work mostly with root diseases and caused by nematode fungi. So for a long time, I've been at Cornell for too long. About 50 years, including my graduate student time. But anyway, I'm delighted really that so many people are interested in this long-term sustainable soil management, not only here in the U.S., but overseas. There have been a lot of international workshop, books written on soil health and so on. And I'm delighted really because I think this is the way to go. Our soil is probably the most limited resource we have on this earth. And we don't have any good soil to put back in production, especially overseas. So, that's a good approach, and that's why I'm delighted to be part of it. But even around here, if you look around, we have a lot of indication that we have poor soil. And across after the first rain, if the soil becomes kind of melt down and become dry and like concrete, that's no good soil. We have, of course, some of our big crop we have here in New York, including cabbage and carrots, and we have to harvest, and sometimes the conditions are not good. And what we have, compaction. I think compaction is our #1 factor of poor soil. Wheat, I'm sure a lot of you relate about it. When we have a lot of wheat, that means that's no good soil. And then also, of course, some of us are biased, including myself. We have a lot of disease, insects, nematode, and that's again a sign of not so good soil. So, the concept of soil health is nothing new, really. The components are the same. You're looking at the physical part of the soil, we're looking at the chemical, we're looking at the biology. But the concept, trying to integrate, optimize these chemical, physical, biological together for increased productivities and in a sustainable and in an economic way. So that's really the new thing about that thing, soil health, is the concept. How we look at it, to integrate and optimize all these factors together. Because really, I'll give the example later. If you have one nut optimum, if you have compacted layer at 6 inches, or those roots going to go right there, stalks are going sideways, and you probably have limited access to soil. So one factor, compaction, could really make the soil not as productive as it could be. And you could name another one. So anyway, so that's what the concept is about, briefly. I'm not going to read all these. This is from a book by MacDoc, Fred MacDoc, and lists all these characteristics of a good soil. And I think you could relate to most of these, but I want to emphasize one characteristic of good soil has very small population or diversity of the bad guys, nematodes, fungi, weeds. That's one part of the concept, part of the definition. The other one, just the opposite. You should have a large, active, and diverse microbial community. The soil gets to be alive. If it is not a live soil, it's not going to decompose, nutrients, make them available. Not going to compose your own organic, material you're going to add to the soil. You would have organic material this high if it doesn't decompose, and a dead soil would do exactly that. Also, with some of these good guys, they attack nematodes, they attack fungi. So, I mean, it's good to have a very active community. And there's more we could. After said that, not all soil are created equally. There are some soil always going to be better. If you have sandy, loam, loam soil, it's always going to be better than silty clay soil. And that will be closer. Some of them are really, as part of their formation, they have better, what we call inherent soil quality. Those are always going to be better soil. But what I think the thing is, there are other qualities, like aggregate stability, like organic matter and disease, presence of disease, weeds. Those are kind of what we call dynamic soil quality. You could change by management. So I want to keep that in mind, that you could improve soil, but sometimes you are limited with the basic qualities, sand, silt, loam, sand, silt, clay, and so on of that soil. And a good soil, well managed, it could be a heck of a lot different from what a poorly managed or poor quality soil. This is real. I'm sure all of you could relate to it. You've seen it. I've seen it many times.
George.
Yes, sir. David.
George, how come you say that you equate soil quality with weeds? Don't good soils create healthy weeds?
Yeah, I guess in a way you have a point there, but we are talking about the function of that, intended function of that soil. And I should have mentioned that. I mean, a healthy lawn or healthy baseball field quality should be a bit different from healthy soil quality to grow cabbage or onions or garlic. So that's a good question, but I mean healthy, you have to think of the intended function or use. When we have people like we talk about aggregate stability, or you should take that back. We talk about penetrometer reading to measure salt resistance. Well, when we start working with the grape growers, we learn fast from them. Heck, you can't put that penetrometer even if you try. So soil resistant is not a good measurement of quality of soil for growing grapes. All that shale and all that stone. So, but anyway, just for the intended use or function of that soil. So if you just want to do biomass, or you want the prairie land to feed animals, well, yeah, I mean, that's all you look at, what else you grow. But for our production agriculture, especially in the U.S. here, weeds are not considered constraint. Okay? Anyway, that's where I'm coming from, all right? But anyway, how to measure this? I mean, our first question is, how do we know about the level of our soil health? And really, I think fortunate and unfortunate, just like human health. And you go to the doctor, and the doctor looks at you, so what's wrong? Well, let's take a blood test, right? Let's take your temperature. So indirectly, and the same thing with soil health. We can't measure soil health directly. So what you do is, you do measure pH for the chemical. You have any of these, or a lot of time a combination of these, and we've done pretty damn good at the chemical part of the soil properties because we've been working on them for years and years, so we are pretty good about the protocol, about what the numbers mean, relate them to plant growth, plant needs. So we are pretty good at that. But also pretty much we know about physical soil measurement, except some of them weren't kind of cost effective to do. And some colleagues at Cornell and other places have kind of modified and made them, kind of streamlined the protocol, and now they are really doable on a large scale, on routine basis. And the same thing with the biological, but we are still limited to biological. There's a lot of progress made on how to assess soil diversity and what microbes in the soil. Even the one we can't grow out, we still could assess if they are there or not there. But again, we can't do them really on a cost-effective thing. And we could do DNA profile, we could do all sort of things, but really it's a research mode. And I'm sure in the future maybe we'll be able to tell you what the biological community soil DNA profile you have and how you change it by changing a cover crop or rotation or tillage. But at this time it's very expensive, and we can't relate it completely to soil function. So we are still limited here. It's still it's still kind of challenged, but we could look at certain organisms, like they are beneficial, like rhizae or rhizobium. We could look at bad one, nematodes, red fungi, insects, arthropods, and things like that. But at Cornell here, my colleague, we started to develop this protocol, how we measure soil health in a cost-effective way, and hopefully relate to soil function. So we started looking at 39 measurements. Each time we sample each unit, each field 4 times a year. But anyway, and we kept doing this for about 3 years in a row, and different part of the state. And to make a long story short, finally we have to reduce those to a manageable one. And this is the list we came up with. If you send a sample to Cornell now, they do all these measurements on your soil sample, you said. We have these physical parameters we measure: soil texture, aggregate stability, water, available water capacity, soil strength, and then we do 4 biological indicators. These are indirect. Some of them are indirect biological indicators. We have organic matter, active carbon, potentially nitrogen, root health. You could blame me for that, but to me, if I have to look at one measurement, and I admit I'm biased, I'll go and dig up roots. Because the roots tell you anything about the physical properties of the soil, if it's compaction, no compaction. They tell you if there's excess nutrient or deficiency of nutrient. And it definitely tell you about damage by nematodes, fungi. So if I have to do one thing, I'll go out, not pull the plant, dig them very carefully with a shovel, with a trowel, and make sure I get all the roots and look at them. And I hope, first of all, we have to know what the normal root should look like, and then you get a good balance. So if you have to do one thing, I suggest you do that. But anyway, and we do the regular, and I'll probably talk to you about all the soil and nutrient analysis. We do the whole list, but we only use a few of them to calculate our soil health index, if you will.